The annual wellness visit unburdens a physician. It frees you up of having to deal with all the details that are involved in this procedure.
EHI clinical services are focused on prevention, and the annual wellness visit is a real resource and tool that the physician can use for making sure that they're better caring for these patients of theirs.
It allows the gathering of very comprehensive information of the patient. And rather than dealing with acute problems as they arise, the physician can help the patient maintain their health over time and just monitor for any changes.
The annual wellness visit takes about 25 to 40 minutes, so the nurse is able to see about 7 patients per day.
It's very difficult for a physician to cover all the patients in his or her practice as comprehensively as we could.
We realize that, some of the social aspects, you don't think to ask. You think because they come in and they come to see you that things are okay, but when you ask those specific questions, you realize, there is a concern or a problem that we really haven't talked about, that they may be hesitant to bring up. I do think that the wellness visits help see the total picture more than just what we look at as far as the medical aspects, so more social.
To become a nurse, underlying is compassion.
Our nurses are very caring, kind, and knowledgeable to meet the diversity of the patients.
We have the resources and a well-trained clinical team that will put the effort needed to cover everything that's needed in an annual visit for a patient.
It really comes down to more airtime with a trained medical professional.
Patients can feel confident that not just the one problem that they have is being looked at, but their entire life as a whole is under the care of the physician.